Assalamu alaikum everyone. Hope you all are having a very good day. I am Zareen Mesbah. This video is a presentation for our individual assignment of the course Medical Imaging SMBE3023. Many thanks goes to our lecturer Dr. Noor Amie for giving me this wonderful opportunity to present my topic. Today my topic is MRI for the diagnosis of prostate cancer. The prostate gland is an accessory sex gland of the male reproductive system, located just below the bladder and in front of the rectum of the body. It helps to provide nutrition and protection to the sperm. So what is prostate cancer? It's one of the most common form of cancer in men, and it raises a lot of serious issues like difficulty in urinating or ejaculation, painful urination, and even nocturia. Prostate cancer is the uncontrollable growth of cells in the prostate gland. This may happen due to mutation in DNA, family history of prostate cancer, hormonal changes, or even excessive intake of fatty food. So how is PCA diagnosed? There are multiple imaging modalities used by far to diagnose prostate cancer, which consists of transrectal USG, CT scan, and nuclear bone imaging. But MRI in particular has had a major impact on the diagnosis of prostate cancer and has been used very commonly than all the other imaging modalities since it gives a very precise image which is helpful in localization and staging of the tumor. The human body is mostly water, whose molecule consists of hydrogen nuclei, which becomes aligned in a magnetic field. An MRI scanner applies a strong magnetic field about 0.2 to 3 teslas, which aligns the protons which was therefore before in a random position. A radio frequency current is produced, creating a varying magnetic field, disrupting the previous alignment. The proton absorbs the energy from the RF waves and flips their spin. The field is turned off, causing the proton to gradually return to their normal spin, releasing energy. The return process produces a radio signal that can be measured by receivers in the scanners and made into an image. Although the current imaging modalities are very successful in diagnosing PCA, some patient conditions might restrict the doctors from using those imaging on them. For example, MRI could be dangerous for patients with metallic implants or equipments inside their body because of its strong electromagnetic field. MRI can also be hard for claustrophobic patients and also cannot easily identify between malignant or benign tumors. There are definitely a lot of ways to improve the MRI process, which is to ensure before the scanning procedure whether the patients have any metallic implants or equipments inside their body. To ensure all metallic outer objects were removed from the body prior to the imaging. For claustrophobic patients, special glasses called prism glasses could be used, allowing patients to see outside. Inquiring about any allergies that patients might have. There are also certain ways to improve the diagnosis of prostate cancer. These are for patients who doesn't have any metallic objects, especially. Recent studies have proven that multimodality imaging such as a PET MRI proved highly sensitive in detecting primary prostate cancer. It has a high detection rate for recurrent disease, particularly when radiolabel PSMA was used. In this case, it should be ensured that the patient isn't allergic to contrast dyes. It helps by providing a more specific and accurate map of localized PCA, which helps in therapy and targeted biopsies. Combining PET with MRI improves detection in biochemical changes in the body, thus eventually helping with staging of the disease. It provides more technical advancement and has greater potential to improve the diagnosis and management of prostate cancer in healthcare practice. Throughout this assignment, I have learned and explored about so many different modalities which is used to detect and help for the treatment of prostate cancer. I also learned about which one is the best and how there are still some limitations affecting the diagnosis for this disease. But as it is said, every problem also comes with a solution, and so I learned how there are different other techniques which improves the detection procedure, making lives easier for both the patients and the doctors. So that's all for my presentation. Thank you all for watching.